Good day everyone, I am Micaela Billones, and for today's video, I'll be discussing about the organs of the respiratory system and their functions. The respiratory system consists of the nose, pharynx, larynx, trachea and bronchi, and the lungs. The primary function of this system is to furnish oxygen for individual tissue cells and to take away the waste products and carbon dioxide produced by those same cells. External respiration is the process of inhaling oxygen into the lungs and exhaling carbon dioxide. That process includes the ventilation of the lungs and the exchange of air in the lungs and blood within the capillaries of the alveoli of the lungs. Internal respiration is the process of metabolic by which living cells use by blood flowing through the capillaries, absorbing the oxygen they need and releasing the carbon dioxide they create. The external opening of the nose is the nostrils, or anterior nares. The dividing partition between the nostrils is the nasal septum, which forms two nasal cavities. Each cavity is divided into three air passages, the superior, middle, and the inferior concha. The concha passages lead to the passageway called the pharynx. Here, the ear is connected to the sinuses, the ears through the eustachian tubes, and even the eyes through the nasolacrimal ducts. The palatine, bones, and maxilla separate the nasal cavity from the mouth cavity. Cilia line the mucous membrane. About 1/4 of mucus is produced daily. The nose have 5 functions. The first one is it serves as an air passageway. It warms and moistens inhaled air. Its cilia and mucous membrane trap dust, pollen, bacteria, and foreign matter. It contains olfactory receptors which smell odors. And lastly, it aids the phonation and quality of voice. The pharynx is the correct term for the throat. It is a muscular and membranous tube that is about 5 inches long, extending downward from the base of the skull. It eventually becomes the esophagus. The nasopharynx is behind the nose. The oropharynx is behind the mouth. The laryngopharynx is behind the larynx. There are 7 openings into the pharynx. In the nasopharynx, there are 2 openings from the eustachian tubes of the ear, and 2 openings from the posterior nares of the nose. In the oropharynx is the 1 opening from the mouth. The pharynx also contains 3 pairs of tissues that are part of lymphatic system. The first one is the pharyngeal tonsils, the adenoids, the palatine tonsils, and the lingual tonsils. The pharynx has 3 functions. Serves as passageway for air, serves as passageway for food, and lastly, aids in phonation by changing its shape. The larynx, commonly called the voice box, is located at the upper end of the trachea, below the root of the tongue and hyoid bone. It is lined with mucous membrane. The larynx contains vocal cords, which produce sound. Short, tense vocal cords produce high notes. Long, relaxed vocal cords produce low notes. We can see several cartilage structures of the larynx in this view. The thyroid cartilage or Adam's apple is usually larger in the male, allowing longer vocal cords and contributing to a deeper male voice. The epiglottis covers the entrance of the larynx while swallowing to avoiding choke. And lastly, The cricoid cartilage contains the vocal cords. The trachea or windpipe is a smooth, muscular tube leading from the larynx to the main bronchi. Cartilage rings prevent crushing of the trachea. The trachea is passageway for air and from the lungs. It is lined with cilia hairs, which sweep foreign matter out of the way. It is only about 1 inch in diameter and 4/2 inch long. The bronchi are the two main branches at the bottom of the trachea, providing passageway for air to the lungs. The trachea divides into the right bronchus and the left bronchus, and then divides further into the three bronchi tree. The branches of the bronchi tree get smaller. The two primary bronchi becomes bronchioles and then very small alveolar ducts. The left bronchi is smaller than the right bronchi because room is needed to accommodate the heart. If a foreign body is inhaled or aspirated, it is usually lodges in the large right bronchi or enters the right lung. In the presence of infection, the bronchi sometimes become inflamed, resulting in diagnosis of bronchitis. The lungs are spongy organs located in the thorax. They consist of elastic tissue filled with an interlacing network of the tubes and sacs that air and blood vessels that carry blood. Each lung is divided in two lobes. The right lung into 3 lobes and the left lung into 2. The left lung has an indentation called the cardiac depression or notch for placement of the heart. At the end of the bronchiole or the alveoli, the lungs contain about 300 million alveoli sacs, which are air cells where the exchange of oxygen and carbon dioxide takes place with the capillaries. The base of the lungs rests on the diaphragm, a muscular wall separating the thorax from the abdominal cavity. It is involved in the respiration, drawing downward in the chest during inhalation and pushing upward during exhalation. Tidal volume refers to the amount of air inhaled or exhaled during normal breathing, about 500 millimeter. Total lung capacity is 3.6 to 9.4 liters in an average male. Pathogens, white cells, and immune proteins present during an infection may cause the air sacs to become inflamed and filled with fluid. This is characteristic of pneumonia. If both lungs are involved, it is termed as double pneumonia. If someone is unconscious, it's possible to aspirate stomach contents in the lung, causing aspiration pneumonia. Vital signs, essential elements for determining an individual's state of health include temperature, pulse, respiration, and blood pressure. A deviation from normal of any or all of the vital signs indicates a state of illness and can be used by the physician in a diagnosis, prognosis, or simply prospect of survival and recovery and treatment. The normal respiration rate for a 5-year-old is 20 to 25 breaths per minute. For someone 15 years or older is 15 to 20 beats breath per minute. So that's the end of my topic. Thank you for watching.